Namaste. Myself Dr. Jyotsna Govindan from the Department of Shalyatantra. So today let us look into a very common complaint encountered in the OPDs, especially pain around the elbow joint known as tennis elbow, and what Ayurveda can offer in such a condition. Tennis elbow or lateral epicondylitis is characterized by pain over the outer part of the elbow at the point of attachment of muscles of the forearm to the elbow. The pain is usually caused due to repetitive stress to the elbow, either due to overuse or due to overstretching of the elbow. This is usually seen in sports players, for example, in case of tennis players, where they have to use their elbows more, for example, in a backhand swing in the play of tennis. But it need not be necessarily only in case of players. It can occur in other causes also, for example, in case of weakened muscles of the shoulders and hands, or maybe due to a repetitive use of the hand, using hand tools, for example, a screwdriver, or it could also occur when you are lifting a very heavy object. As I mentioned before, now the pain is actually localized on the outer part of the elbow, but if the severity increases, it could radiate to the forearm also, and it may also be associated with weakness, especially while grasping objects. Pain is seen to get worsened, especially while you are straightening or extending the forearm and the wrists. The usual managements for tennis elbow are usually rest along with medication, maybe physical therapies, supportive braces, surgeries, and so on. Now, what is tennis elbow, or what is the concept of tennis elbow as far as Ayurveda is concerned? Now, in Ayurveda, such a condition will be correlated to afflictions to the connective or the supportive structures of a joint, which are known as snayus or kandara. And usually the treatment principle in such a condition is to reduce the inflammatory changes which have occurred. Now, as we know, in tennis elbow, because of the repetitive stress or the repetitive injuries, repetitive use that you are using over the elbow, there are micro traumas which are occurring and which is leading to the inflammatory changes. So, Ayurveda actually focuses on trying to get these micro traumas to get healed in a faster way. So, we have to deal with the inflammatory changes, and along with that promote faster healing of the trauma which the elbow has incurred. So, the treatment in Ayurveda is basically focused at removing the inflammatory swelling which has occurred, or the shobha which has occurred over the elbow, and we opt for various treatment modalities depending upon the condition of the patient. So, usually the physician will consult, or so the physician will look into the condition of the patient and will determine which treatment would be more good for you. So, the treatments, there are various treatments which are available, and basically if we have to mention a few of them, the first one would be bandaging along with the medicinal oil applications, which provides not only immobilization and rest, but also helps in faster healing. Then we have a dhara, where we use the medicinal decoctions to be poured over the area so as to reduce the pain and the swelling. Or maybe external application of medicines which are known as leba, which are also focused on reducing the inflammatory swellings as well as reduce the pain. Another treatment procedure which Ayurveda has to offer is the procedure of Agni Karma, or as the term means, the use of Agni or heat. So, here we use Agni Karma in conditions of pain where not much of chances of suppuration are present. Now, in the procedure of Agni Karma, we use a specialized or specially prepared metallic rod known as shalaga, which is heated up to a high temperature and is kept over the area which is to be treated, or usually the most painful area, maybe just for a microsecond, and then it is removed. Now, this heat is actually not sufficient to produce a burn. Nevertheless, it actually helps to trigger the body agents or the body factors which are anti-inflammatory in nature, so as to move to that area, remove the inflammatory changes or the swelling which has occurred over that area, as well as promote faster healing. Agni Karma can be done either as a single sitting or maybe in a repeated sitting. Now, that depends upon the condition of the patient, whether it is more severe or less severe. Not only the application of Agni Karma, but along with that, we may also require to give internal medications which also help to promote faster healing and also could contribute to the prevention of recurrence of such a disease. So, Along with the proper management, Ayurveda also advocates the proper rehabilitation of such a condition, and that is done according to the classical texts which mention what is to be done in such a condition. So for a wholesome treatment of such a disease and so as to prevent its recurrence, Ayurveda would be the best treatment modality to be opted.